Well, Dr. Reardon, it's a pleasure having a world-renowned cardiologist with us. The FDA just approved a new device for the heart. Tell us about it.
Yes, the CoreValve device is a self-expanding metal frame, a metal called nitinol, that has a tissue valve sewn inside of it. And we compress this at the end of a delivery system and cover it with a sheath or a capsule. And then we can pass this delivery system over a wire through the artery in your groin into the blockage in your aortic valve, or the valve that lets the blood out of the heart. As we pull the sheath or capsule back, it lets this new valve expand or flower into position where we want it. And as it expands, it pushes your old valve out of the way and lets the new valve fall down into place. Then we remove the delivery system, and voila, you have a brand new heart valve without open heart surgery.
Well, doctor, what has you most excited about the device?
Well, because I've treated these patients, and I've watched the 89-year-old great-grandmother come in, somebody that if I operated on her, if she were to survive, it would be a very difficult recovery. She'd come out with a breathing tube, she'd be on a breathing machine for hours, she'd have tubes in her chest, and a long recovery. I now see that same 89-year-old lady come in, I make a half-inch incision in her groin, puncture the artery, run this up through the artery. We can even do this under local anesthesia with sedation, but even if we put you to sleep and we're done, I wake you up in the hybrid lab where I do it. I take you back to the ICU talking to you. When your family first sees you, instead of being on a machine and looking like the bionic woman, you're chatting with them. This is much less stressful for the patients, much less stressful for the family. These patients get back to a full life much quicker.
Well, that certainly is great news, Dr. Reardon. Thank you for sharing your passions with us and the new announcement on the new device for the heart. It sure is awesome.
Okay, it's my pleasure. Thank you for having me on.